Okay, well, obviously, thanks a lot for inviting me to discuss a very important topic. And I do hope my experience and views that have been shared with Professor Murphy are of some help. I'd just like to forewarn you that some of our views and ideas might first appear as very radical and extreme, and they're best considered after some space for reflection. And I think upon reflection, they become much more rational. I personally have worked in healthcare all my career, 40 years, primarily with men and boys who manifest their distress through dangerous and offending behaviour. I've been fortunate not to have had many suicides to deal with, but I have investigated a lot throughout my career. So it's a topic that's really important in my world. So just to go over the figures, there is a significant increase in the likelihood of men and boys killing themselves if incarcerated than outside. However, I think an important figure is that within 12 months of release, you're 8 times more likely to kill yourself than within the general population. And I think that the numbers vary from year to year, and obviously because of the pandemic, there's been a reduction. There's been a reduction in society and there's been a reduction in prisons. And I think that they're for very, very different reasons. I think the reduction in society is possibly demonstrable of how many people may attempt suicide, but at some level don't want to die. And having the knowledge that there will be no services there to save you at the last minute may have prompted their decision-making to maybe resist attempting to kill themselves. And I think that's very clear within society, but I think the reduction in prison is because the men have been locked up, and therefore there's less bullying, there's less access to drugs, there's less exposure to shame, and whether we like it or not, there are many, many acts of kindness in prison, and the space to spend time with cellmates and reflect on things may have been a factor in reducing the suicides in prison. So I think it's really important that we differentiate these two dynamics that have risen because of the pandemic. There's contributory factors prior to going into prison, and I can't underestimate enough the levels of trauma that are unresolved in boys and men, and again often seen as not a traumatic experience. And one of the salient examples being that if a 13, 14-year-old boy has sexual intercourse with a 25-year-old woman, it's seen as a way of passage rather than an act of abuse and an act of behaviour that the young boy is not ready for emotionally. And boys are more expected to tolerate violence and get into fights, and so there is so much unresolved childhood trauma that we just don't know about. And I think if you look at Epstein and the Savile cases, the numbers of people that were abused are much more than the number of people that came forward, and it just demonstrates the amount of people who live in silence, who live with trauma under silence, and primarily a lot of that is because they've picked up the shame of their abusers, and it's such a confusing time for them. They often come from a disadvantaged community and cannot access the mental health services that maybe they should be able to. And sadly, some of these men are refused mental health services for presenting with the symptoms of their mental illness. So it's so often that maybe someone with affect regulation difficulties is told that they have to manage their mood before they can access treatment. Some drug addicts are told they have to stop taking drugs before they can access treatment. People with personality disorder are told if they're antisocial then or they're rude, then they'll be discharged from treatment. So we often discharge them because they present with the symptoms of their condition. That's much more in men who are much more likely to use a toxic approach to managing their affect than women. There is enforced stoicism in little boys who have been abused, and sadly a lot of these people that come from environments where the currency to manage affect, emotions is to anger, is sex, is alcohol, is violence. And these young boys aren't taught about the other emotions. And I think we forget that you have to be taught about your emotions. Children have to learn emotions. They're born and they have these experiences, but good parenting tells them that they're feeling sad, they're feeling happy. Children have to learn that, and a lot of these men and boys don't get the opportunity. They feel one thing, they feel angry or not angry, and there's very little in between that. And they're not able to, it's not safe for them, if you like, to test out emotions such as sadness, such as fear, such as vulnerability, because they have to remain angry because that's the safest emotion. And therefore it's not surprising that they have great difficulty in regulating their emotions. Sadly, the prison service is set up to address everything in a sort of cognitive way. So all the offending behaviour programs are cognitively driven about how you think and what you think. But mostly, a lot of people, when they offend, it's that they're not thinking, they're feeling, and we haven't got enough resources exploring the dynamics of emotions and affect and impulsivity, and encouraging these people to learn how to regulate emotions and how to convert anger to sadness and shame to compassion, etc., etc. It's something that we've done very successfully on the FENS unit, but it isn't something that's done out with that, because there's a lot of investment, if you like, from a lot of prison staff not to allow these soft emotions in, because the prisons have to be dangerous, they have to be violent, they have to be aggressive, because a lot of staff's identities are wrapped up in that. It's often a cheap enhancement for staff's low self-esteem. And I believe very much that the most successful staff are staff who have accomplished something in a career prior to becoming a prison officer. It is an environment that does attract the wrong kind of staff, sadly. There is increased rates of mental health problems in this population as well, and it's the complexity of the mental health problems, often the comorbid of personality disorder and a mental illness as well. And I can't underestimate the high levels of shame, sadness and fear and hopelessness that is prevalent in prisons, and that a lot of these boys carry the shame of their offenders because it's a contagious, emotions are contagious, and these young boys carry a shame that just doesn't belong with them. Shame is distributed in the prison. We use it in society. It's very, if you look at Prime Minister's Questions Time, it's about how you best shame people. It's not how you have an intellectual debate about them. And shame is used very focused in prison. And it comes down from, as I say, it comes down from staff who distribute their shame onto the prisoners, and they see themselves as enhanced because they haven't done what these prisoners have done. And then there's the offence hierarchy, where the offending is categorised depending on shame, with maybe child sex offenders at the bottom of the shame level, or possibly it's now the phone hacker that might have usurped that, but shame is distributed throughout. Shame is one of the biggest causes of murder in the UK, revenge against shame. And also it's the inability to tolerate shame that drives suicide. It's the inability to sit and tolerate or convert this toxic emotion that results in people killing themselves. I really can't underestimate the damage this one emotion can do and how little it's explored within prisons. And of course, they learn these coping strategies that impact on their moods. So they're addicted to drugs, they're addicted to gambling, they're addicted to sex. And then there's other addictions. They're addicted to complaining, they're addicted to moaning, they're addicted to being suspicious, they're addicted to using violence. It just increases and increases until they avoid dealing with the emotions that they feel too vulnerable to allow to be exposed. And again, that's something we have done successfully in the FENS within groups, is allow them to negotiate, alternative emotions, to convert anger to fear, and to sit with that and to experience nurturance from fear rather than hostility from anger. And they're less likely to be in a relationship. Is this making sense? So the contributing factors during custody is that prison is traumatizing. And as I said, some staff need that dynamic for prison. They need it to be traumatizing. They need it to be a place of danger, a place of risk that, we're dealing with the most dangerous men in the country, because it enhances the staff's identity. And it would be, contrary for them to be, prison officers looking after, very, very vulnerable men, looking after men through a compassionate lens, looking after men who are fairly incompetent. And although you do get psychopaths in prison, that, without being disrespectful, they're stupid psychopaths, because, psychopaths don't go to jail generally. So that they're all wrapped up in this overarching trauma that impacts on staff as well, and there's no space to reflect on it, and very little space to make sense of it. One of the dynamics on the Fens unit, which is a 70-bedded prison wing at HMP Whitemoor, and we've been running this model for 18 years. In the past 16 years, we've had no suicides, despite housing complex psychopathology that goes beyond what you would find in Broadmoor or Rampton. So one of the dynamics that we use is to think about addressing trauma, to look at the trauma, and to support the operational staff and making sense of what attracts them to the job, what they can bring to the job, and what can be very traumatizing about the job. And we have converted staff who have been very disciplinarian to becoming very compassionate, but not losing any sense of empowerment or any sense of personal identity. When you put into custody, there's an additional transition, and we all know that transition also includes chaos while they're adjusting to prison life. They're dislocated from family, friends, and children. And again, that's a very important dynamic. Most men who kill themselves in prison don't have any connections with family, and they're left with uncertainty and fear and hopelessness. And again, this fear and hopelessness is converted into anger, it's converted into rage, it's converted into something that's more tolerable for them, because it's not safe to be frightened. And environments need to encourage different types of affect. They have very inconsistent regimes that can change on the turn of a key, no pun intended, but change is supposed to be something that's planned and done in a thought out way. But sadly, in prisons, regimes change very, very abruptly, very quickly. From the minutiae of, someone could be on the phone having a distressing call with, and the regime insists that they have to go back to their cell immediately. And that in itself could be a trigger. And it's just something to think about, the impact that might have on one individual. I think the prison failed to create communities or build support. And again, I have witnessed so many acts of kindness and compassion in prison from prisoners, and prisoners who challenge operational staff who may not be as compassionate as they could have been in situations. But it's about harnessing that, it's about using that dynamic and encouraging it. And it's something we've done successfully in the Fens, is to give prisoners an identity and a sense of high self-esteem when they do act out these kind acts to other prisoners. And I think that's been possibly a salient issue during the pandemic that's reduced the levels of suicide. And they have very little control over their lives. And when that control is reduced, then there is more risk of suicide. They have a lack of purpose. There isn't a lot of good working prisons. At the moment, we are still using overhead projectors. Prisons are scared of moving and being progressive and using technology and developing all these services that could help enhance prisoners' self-esteem, self-worth, and reduce shame. Sadly, prison generally don't attract quality mental health services. They rely very much on agency staff who sadly often see working in a prison as an easy paycheck, distribute the medication and do very little else. And I think mental health staff who do attempt to work within the prisons, I think you have to be very thick-skinned, because there is a lack of respect for your profession from prison personnel. And we know that boredom and lack of distraction is also a salient dynamic in prisons. Mental health training is poor. Mental health training in prisons is like Chinese whispers. By the time it gets to the staff who are working, it's changed so often because staff have reinterpreted it as it goes down. And I've sat through mental health training in prisons where it's factually incorrect. It is just so incorrect. On occasions, it's frightening. And I want to address this issue, really important, that there is, this lack of differentiation between self-injurious behaviour and suicide. They are two completely different beasts. Self-injurious behaviour is a dynamic that people often do to stay alive. They cut themselves to feel alive. They self-harm as a way of coping. There is so many different reasons for people using self-injurious behaviour. It can be to bully staff. It can be to get an opiate release, a natural opiate release from the body, so it relaxes them. It keeps them alive. It keeps them on regular watch if they're on the ACT review. I have seen patients self-harm in order to get out to hospital because they're concerned about a physical condition that they're suffering. And on one occasion, one man self-harmed to get out to hospital, and whilst out at hospital, he was diagnosed with bladder cancer, and he knew there was something wrong with him, but he wasn't being attended to within the prison. And can you really say that on that occasion that self-injurious behaviour was pathological, or it was driven by a mental health problem? Sometimes people self-harm in prisons because it's the most logical thing to do in that moment, and it's not got anything to do with suicide. I mean, we have a epidemic of self-injurious behaviour in the society just now with tattoos. Everyone has tattoos, and effectively it's deliberate self-harm. So I think it's really important to separate these two things out. They are mutually exclusive. Suicide is someone wanting to end their life. That is not what self-injurious behaviour is about. And when they collapse them, and again, this is an example of poor mental health training. To collapse these two things is a big mistake. And I think more often than not, people who are self-injurious are considered to be suicidal. It's not the case, and I can't stress that enough. Obviously, there's too low staff numbers. There's a lack of transparency, and there is a lack of accountability. There is no professional accountability in prisons. That prison governors aren't held to a professional board, and prison officers aren't held to a professional board, and it's really difficult to complain about these staff in a way that might impact on them. So there needs to be some level of accountability in prisons. So moving on to the recommendations, obviously I think it's so important that we reserve prisons for the dangerous and staff it with people who do not need to be associated with danger to enhance their own identity. And with that high in staffing levels, the fabric of the buildings internally and externally, it needs to be improved. And there is some research that prisons where there's greenery, that there is less suicides in the prisons where there is outdoor greenery. We have to improve training, mental health training across the board, but also training about emotions, toxic emotions, healthy emotions, and the difference between self-injurious behaviour and suicide, and take these down two different roads. So, for example, women are more likely to self-harm, but the figures shows that men are more likely to kill themselves. So if there was a correlation, you would expect that women would be more often killing themselves than men. there's something about ensuring access to justice for bereaved families who believe that, you know, that their loved ones could have been saved. I think we need to establish an independent body with accountability to Parliament, because often, in my experience, often these suicides were preventable and could have been preventable but it's an overarching set of systems that needs to be in place. And I think it's time that we professionalise prison officers and governors. We're still using the same model that we used in the 1800s, and I think it's time to see these as professions and become more progressive about what their role in it and what their responsibilities would be, rather than leaving it to them to decide that, you know, they look after the most dangerous men in the country, and therefore that's what they're designed to do, is to save people. And effectively, more often than not, the prisoners who don't cause any trouble in prison often leave without addressing their offending behaviour. This concept of model prisoner effectively means you leave your offending behaviour at the gate and pick it up on the way out. And whilst in prison, you just behave as well as you can be to become a model prisoner. So we really have to think about how we logically make sense of prisons in the 21st century. We could be encouraging more compassionate inquiry.
Sorry to butt in, Des. We are running a bit short of time.
Okay, I'm just about finished. Encouraging compassionate inquiry is really important, and it can, you know, change and shift from using judgment and self-driven evaluations about what prisoners have done and how the offence hierarchy is created and how shame is distributed in prisons. We have to disconfirm the toxic masculinity that's, you know, the prison has a proclivity of using that, and it's not gender specific. I need to stress that there are so many female prison officers who present with toxic masculinity, and it's something that we do have to eradicate, and it's manifest in so many different ways. I think an improvement in staff selection is essential. Why do people want to, you know, have a career locking other people up? You know, why? What is it that's rewarding about that, and make sense of that? Disconfirming the offence hierarchy that holds all the shame, and you know, they decide what's the most shameful and not the most shameful. Increase the understanding of role and shame. I think we need to introduce long-term placements for governors. We have been very successful on the Fens, and in the 18 years it's been going, there's been 2 senior staff in healthcare, whereas we've had 17 different governors in that time. And that just leaves a lot of chaos and a lot of repeated work having to do. There needs to be a review of leadership practices, because I think the concept in prisons is that the more senior you are, the less involved you are with day-to-day work and in contact with the prison wings. And I think we need to move away from the one-fits-all logic. And I hope through the presentation, you know, encourage you to think about where your logical position is and how that possibly may not be the best one to think about in the context of prisons. And thank you for listening.